Right. Good evening, guys. I can see people joining. So for those who are already here, thank you for joining us tonight. My name is Olivier Picard. I'm the Vice Chair of the National Pharmacy Association. I'm going to give a few more minutes for everyone to join, and then we'll get going. We've got a great panel this evening, including Paul Rees, our CEO, as well as representative from Wales and Scotland. So thank you very much all for joining us. As I said, the people are still joining. We'll give them a couple of minutes, then we'll get going. Well, I think, yeah, the number are still trickling through, but in order for us to attempt to finish on time, I propose that we get going, and the strugglers will join us as soon as they can. I would imagine everyone's had a busy day, a busy week so far. We are certainly very busy at the NPA, and we really welcome your support and welcome to this evening's webinar. This is the second of webinars that we're hosting about our Day of Action. For those who were able to join last week, you hopefully were able to have a briefing about perhaps the action that we have taken so far, the ideas that we were floating. But now we are going into the meaty part of the event, where we are really talking about the event next week. And yes, it is next week, next Thursday, the 20th. This is gaining really real momentum. And we've had messages from our members across all the nations, getting in touch to say they're gearing up for the event, whether this is having their patients signing the petition, and we're receiving the petitions at the NPA, so thank you very much, as well as the media coverage, social media, where we are starting to see what people are getting up to. So really welcoming all that. In terms of coverage, for those who don't follow Paul on the social media, I would strongly encourage you to do so, because he's out there with members and he's also out there talking to the press. There was an article last week in the Daily Mail. It was also covered on Talk TV last Friday, and Paul today had an interview with Sky News. So you can see that we're really out there engaging with the press, because as Paul would have you known, if you can have the press on your side, you really are able to make a big difference. In today's webinar, we're going to give you more information about what the actions would look like for next Thursday. Yes, it is next Thursday, the 20th of June. We're also going to give you perhaps some information about how to take part if you've not seen everything already, and what to look out for in terms of communication from the NPA. We will also know how things are looking in Scotland, in Wales, and in Northern Ireland. Because remember, the NPA represent pharmacies in all 4 nations, and we want this action to be across the whole of the United Kingdom. Finally, our board member, Bal, will say a few important words about how to take part. And last week we had Suki on the webinar. Today is Bal. All the board members of the NPA are taking part. Now, I hope we all have a good webinar. I'm going to hand over to Paul, our Chief Executive, who's going to take us through his presentation, and then we'll move on to the other guests. Thank you very much. Over to you, Paul.
Brilliant. Thank you very much, Olivier. Good evening, everyone. I've been having a few IT issues at my home, so I've asked the kids and the family to stay off Xboxes and Netflix, so hopefully the signal will last. But I will, without further ado, move on. So if we can move on to the next slide, please. Obviously, this has all been triggered by the fact that Rishi Sunak caused a surprise election a few weeks ago. And if we move on to the next slide, essentially, we've sent out lots of campaign packs. Hopefully, you've all received them. with poster stickers. And then next slide, we've also sent out a postcard to be sent to candidates. And we've got a petition, and we're encouraging people to collect as many signatures as possible. And if we move on to the next slide, we've sent out a special edition of our poster and campaign pack to members in Scotland, Wales and Northern Ireland, because whereas in England there have been a deluge of closures, obviously there have been closures in Wales and Northern Ireland. There haven't been closures in Scotland, but of course the issues are very similar but slightly different. So we've sent out a slightly different version of the poster and the postcard, and hopefully people have received those packs in Scotland, Wales and Northern Ireland either today or yesterday. Next slide. So I've been out and about. I meet members on a regular basis every week, and you can see here, this is me visiting a couple of pharmacies in Ipswich, one in Cumbria, one in Hastings yesterday, and there's also a picture of a pharmacy in South London, and you can see people have got the poster up, and it's attracting interest. Patients are coming in and asking members of the pharmacy team, what is it all about? So we're starting a conversation. Next slide. So we've been having success in getting the issue of funding of pharmacy and the medicine shortages, the lack of proper funding in the election. I was on BBC One News the weekend before last. Nick, our chair, was on the Today programme. We were quoted on the BBC News website in response to the Conservatives' pledge to expand pharmacy first.
Right,
Laura
guys.
Kunsberg used our lines when she pressured the Health Secretary, Victoria Atkins. Next slide, please. So other organisations have been campaigning as well, and we were part of a group called Vote Pharmacy that are campaigning for better funding. So CPE, CCA, and the Royal Pharmaceutical Society. Next slide. We're trying to influence the election, and that's the three main parties, and of course, the conversation in Scotland, Wales, and Northern Ireland. Next slide. The great news is, although we are still way short of the funding we need, and people are in a really desperate place, the parties are actually starting to talk about pharmacy in their manifestos. So the Conservative manifesto, published a couple of days ago, pledged to increase funding for Pharmacy First in England by 1,150%, £250 million a year. And obviously, pharmacy funding is a devolved issue, and so we hope that people will be inspired to take similar action in Scotland, Wales and Northern Ireland. Next slide. The Lib Dems also have put community pharmacy at the heart of their manifesto. They've pledged to work towards a fairer and more sustainable long-term funding model for pharmacies and build on the pharmacy first approach, and also more rights for IPs. I was talking to a senior person in the Department of Health earlier today, and she said never before has community pharmacy been at the heart of manifestos in the way it is so far in this election. Obviously, the Labour manifesto is yet to come out, and we hope that community pharmacy is also at the heart of that manifesto. Of course, as we know, the Labour manifesto is particularly important in this election. Next slide, please. So we've got a One Day to Save Our Pharmacies action, as Olivier said, on the 20th of June. That's next Thursday, just next week. Next slide. So we asked our members whether they'd like to take action. On the 20th of June, 99% said yes. Next slide. We asked people what action in particular they'd like to take. Turning off the lights in the pharmacy for 2 hours is the yellow bar. That was the most popular. And then promoting the Save Our Pharmacies hashtag was also popular. Asking staff to wear black and blacking out windows also was particularly popular. And there were a range of other suggestions, but they were the ones that seemed to be the front runners when we did the poll, and we're grateful to everyone who took part. Next slide. So on the day itself, we're asking people, it's a menu of options. We want everyone to take part and do what they feel they can do. So turning off lights between 9 and 11 in the pharmacy, but please do bear in mind our separate guidance note. Promoting the day of action using the hashtag Save Our Pharmacies.
Sorry, guys.
See separate guidance. I'll mention that in a moment.
Paul, you've just gone out for a couple of seconds. If you can pedal back maybe by 20 seconds, you just went silent on us all.
Of course. So the actions are turning off lights in the pharmacy between 9 and 11 in the morning, but we have issued separate guidance in terms of making sure we keep patients safe and staff safe, promoting the day of action using the hashtag Save Our Pharmacies, asking staff to wear black, blacking out pharmacy windows, again, making sure we respect patient safety and staff safety, inviting parliamentary and highlighting the challenges you face in the local media and on social media. Next slide. So we're asking you to do what you can, but we're also asking you to make sure you don't put yourselves, your staff, or your patients at risk. Next slide. So in terms of turning off the light, this is a symbolic act, and we're asking you to turn the lights off between 9 and 11, but please don't turn the lights off in your dispensary, as we want to avoid any dispensing areas or in areas where you think patients or staff could trip up as a result of reduced lighting. Next slide, please. Wear black for the day, that would be fantastic. It's very symbolic. Next slide. Also blacking out windows. Again, if you could make sure that there is not such a shortage of lights that it causes obviously a risk to safety to you, your staff, your patients or customers. Next slide. Posting support on social media is fantastic. Really trying to get the conversation going using hashtag Save Our Pharmacies on Twitter, now known as X, and other social media channels. Next slide. Contacting your local media. A number of local media outlets have already covered the day. National media starting to cover it, as Olivier mentioned earlier. The Daily Mail, Sky News, Talk TV, but local newspapers and websites are as well. So please do engage with your local media in advance of the day and on the day if you can, please. Next slide. Contacting candidates. A lot of candidates have been to pharmacies. They've seen the posters, and they're being briefed on why people are taking this action and why it's so important, and just how much pressure the pharmacy network is currently under. Next slide. We've got a petition, and it's you've been sent copies to pharmacies, and there are more copies you can print out from our website. Next slide. And if you can ask people to join you outside the pharmacy, Olivier did that a few years ago, and that was incredibly powerful. Olivier may talk about it when he comes to sum up towards the end and go towards questions, but having people protest outside the pharmacy, your customers, your patients, that is an incredibly powerful way of getting across just how important this is. Next slide, please. So we've had a number of questions. One of them was, will insurance, MPA insurance cover any slips or trips? And what we've said is please follow our guidance in terms of ensuring everyone stays safe. If you ensure that these measures are carried out, you should prevent any patient safety issues. And highlighted in yellow, in the exceptional event there are any incidents on the day, MPAI, National Pharmacy Association Insurance, will deal with claims. But obviously we can't speak for other insurance companies. Next slide. Other implications for staff. So obviously we're asking please to ensure that safety, health and safety is remembered, both for patients and of course for staff. And if you're ensuring the safety of your patients, that will of course ensure the safety of staff. And obviously if you can just make sure you're considering how to manage the risk in your pharmacy or pharmacies in each case. Next slide. How do we manage customer perceptions who might worry unnecessarily about the local pharmacy closing? Obviously, the purpose of this day is to start the conversation, get people talking, get people behind the campaign. So it's really important that people are talking about it in pharmacies across the 4 nations. And clearly you can allay people's fears about your own particular pharmacy, but the important thing is to get the conversation going, get those people engaging with their parliamentary candidates and going on social media and signing the petition. Next slide. Are there any GDPR issues around our petition? We've been asked that by a few members. So we've sought legal advice from one of the leading legal firms, you'd be pleased to know, in London, and what they're saying is that from a data protection perspective, when people sign a public petition, they do so knowing the data they provide will be seen by others, and their data may be shared with the government members and officials when the petition is submitted. There is a legitimate process of personal data with our petition, and that's covered by our data protection policy, which can be found on our website at mpa.co.uk/data-protection. And then for those who'd like to use a version of the petition sheets with the privacy statement included, if you go to the printable version of our petition sheet, that has got the privacy statement right at the bottom. Next slide. Can I take stronger action? What are the risks? Well, we've taken legal action, legal advice on other actions. The advice on cessation of core services was that it runs the risks of members being in breach of the terms of their service agreements. So we'd advise against encouraging, also what our lawyers said, they'd advise against encouraging pharmacies to engage in this form of direct action, as there could be quite severe results. We've also taken advice on cessation of voluntary services, such as free deliveries, and our lawyers advised us that actually, again, it runs a risk, not obviously being in breach of contract, but at a very tight and straitened time, that customers may then vote with their feet and go to other pharmacies because they can't get the service. So what we're suggesting in our day of action is action that doesn't affect patient care, but makes the point and already is getting the media talking, and other national media outlets have been in touch with us about covering the day and talking about the funding crisis in community pharmacy. Next slide. So we're doing a member survey on opening hours, which we publicised via our weekly roundup last week. We send out a weekly roundup at 5:45 every Friday evening. So please do take the time to fill in the survey. The surveys you do fill in on our behalf, we use the information that comes from those surveys to generate national media stories and highlight the issues that you're facing. So we're so grateful to all of you for taking the time to fill in our survey. So in terms of the latest survey, it's asking, first of all, which country your pharmacy is in. If we move on to the next slide, it's then asking how many hours a week did you open to the public in 2019? Because, of course, we're trying to establish what opening hours were like then and what they're like now. So the next question, if we move on to the next slide, is has there been any change in your weekly opening hours to the public since 2019? And then the next slide, please. Thinking about weekend opening compared to 2019, have there been any changes in your weekend opening? Of course, we know that's been happening for many pharmacies across the 4 nations. Next slide, please. And again, thinking about your opening hours to the public, what are you thinking about doing in the coming year, over the coming period? And again, it would be great if you're able to answer that question as well. Next slide, please. How do we use the results? As I've mentioned, we use the results to help us generate further national media coverage. We were on the front page of The Guardian a couple of months ago. We generate further media coverage to highlight the crisis that community pharmacy is in England, Scotland, Wales, and Northern Ireland. So every bit of filling in surveys and polls helps us carry the fight further by generating the coverage in the national media. Next slide. So ultimately, everything is about trying to ensure we have a fairly funded community pharmacy sector across all the 4 nations of the UK. And on that note, I'm going to hand over, I believe, on to Janice.
But back to me first, very briefly.
Back to you. Okay, back to you, Olivier. Thank you.
That's all right. I just wanted to say a couple of things. First of all, you told me you would fit that in 10 minutes, but I think it was worse the 13 minutes that you took there, because you had a lot of information to give us. I also wanted to say to everyone before I brought Janice online, is there is a Q&A button at the bottom of your screen. This will allow you to ask a question. I can see some people have already worked that one out. Do feel free to put your name in there. We want to know who is on the webinar. We also want to know what you're going to do so we can support you, because it is not about being a secret mission here. It's all about being in it together. So, you know, as Paul said, I'm planning actions around my pharmacy, and I'll share a little bit more with you at the end. But yes, please do ask the question, not in the chat, but in the Q&A button at the bottom. Over to you, Janice. What's happening at your end of the woods?
Thank you. Well, I'm just going to touch on Northern Ireland first. So unfortunately, my colleague from Northern Ireland couldn't attend today. But members in Northern Ireland are really feeling it very hard, like elsewhere. There's been a significant funding shortfall in Northern Ireland for a significant period of time. The medicine shortages that everywhere else is feeling are very acute in Northern Ireland, adding to the time and pressure that everybody's undergoing. And of course, all the workforce costs that have been across the UK felt in Northern Ireland as well as anywhere else. There have been some closures, but small numbers of closures, and actually not really in the independent sector. The negotiating body, CPNI for Northern Ireland, has already been engaging with politicians and trying to alert the public to the state in the network in Northern Ireland. So their campaign that CPNI are driving links very closely with our Save Our Pharmacies campaign, and CPNI are very, very supportive. In all the countries, we've been working very closely with the negotiators and with our members to make sure our messages are right wherever they are. And particularly in Scotland, we have had no closures. So the messages have to be slightly different. They have to be amended where we are in Scotland. But yes, the medicine shortages absolutely felt. The workforce increased costs absolutely felt. And then to top it all, we have had nearly a year of inaccurate payments coming through from the NHS. They decided to change the system, and the system has not been fit for purpose. So all our members in Scotland have not had any advance of what they've been paid, don't know whether they've been paid as right, whether they've been overpaid, underpaid, and then significant clawbacks if there has been an overpayment. So it's meant there's been very, very little sustainable planning for the pharmacy network. And additional costs that have really been ramped up because of that system. So we had a forum in Northern Ireland. There's a forum coming in Northern Ireland very soon, but we had a forum in Scotland, which was very, very well attended. And there was a very loud voice there wanting the NPA to advocate for Scottish members and explain to politicians and the public exactly what we're experiencing here. So we do have different messages. There is a focus on the open door because there hasn't been closures, and it's about protecting that open door of pharmacies, keeping it that way that there is an open door, but highlighting the fact that our pharmacies are having to look at how to make ends meet. Never before has it been a case that we don't know actually we're going to cover our outgoings here. So it is about, do we have to cut staff, etc., what are we doing services wise, and highlighting the medicine shortages. So health's evolved, so why do we need to engage in this election campaign? Well, in Scotland, the election campaign is everywhere. Every politician, whether they're standing as an MP or whether they're standing at the side as an MSP, are aware of what is getting said, what is current, what's happening. And the public are absolutely watching exactly what every party and every politician is doing as well. So it's an amazing time to take that opportunity to get your politicians understanding what we're experiencing in every country across the UK and engage with the public to have those conversations so that they understand what pharmacy teams are going through.
Thank you very much, Janice. That's part of me always think that the grass is greener on the other side of the fence, but actually we're all in this together, aren't we? It is tough wherever you are. And for those who don't follow international news, you might have seen that pharmacies in France, I am French, pharmacies in France did take industrial action last week as well. So whilst we think it's the better elsewhere, it probably isn't. And is it right? Probably not. Should we, after everything we've done, be better looked after? Probably. And this is why we want you to join us on this day of action. Thank you, Janice. Questions are coming through. I propose to listen or hear from everyone on the call, and then we will manage your questions if that's okay. So please bear with us whilst we do that. I don't know if we have Rodri on the call.
Yes.
We have. Hi, Rodri. Nice to see you again. Over to you. What are things like in Wales?
Thank you, Olivier. Well, much like Janice has hinted on, there's a lot of questions around why are the NPA doing this now in Wales, because of course health is a devolved issue. But also we've had lots of our members say that it's an incredibly challenging time to operate because margins are being squeezed and funding is insufficient for what we are required to do. So to give you an idea, in the last 4 years in Wales, we've gone from 720 pharmacies down to 686. So they are closing. And the reality is that when questions are asked in the Senedd around pharmacy funding and they answer, oh, well, pharmacies in Wales get more money, the reality is we are expected to do more. With the way that the service and clinical aspect has been rolled out, the reality is the costs that contractors are having to meet on the ground are higher. So in reality, we share the pain right across the board in that it is an extremely challenging environment to operate in. And of course, we share a drug tariff with England. So the margin that we get on our medicines are exactly the same contractors in England receive as well. So as Janice alluded to earlier, it is a really important election for our members in Wales to engage with their politicians and to make sure they understand how challenging it is to operate at the moment, and to highlight these challenges that even though health is devolved, Westminster still has an influence on what happens in the devolved nations. So for you as members, how you can operate is that obviously you've had the materials shared out and they've been received. So hopefully those have been received in the devolved nations as nation specific as well. So you can use those to engage and highlight to your patients as well that how the pharmacies, they're doing what we can, but is very challenging. And so the message we're getting from our members is that services that they used to do for free, like deliveries, like MDS trays, they're unable to do so. So use that as an opportunity to explain to your patients why these difficult decisions have to be made on the ground. And that's it from me.
Thanks, Rodri. Again, very insightful. When we visited Wales with the NPA a few years ago, we knew there was a lot of changes, and we all know how margins are tight, and it is clearly not reassuring that things have gone this way. But as you have heard, we've produced a material in Welsh for you, so hopefully your members can take part as well. That's wonderful. Thank you for that. Now I believe we have Bal on the call, although I can't see him. Bal, are you here? Yes, so Bal had some issues joining. I don't know if anyone had seen Bal. So what I propose we do is, whilst we wait for Bal to join us, if indeed he can, is to start going through some of your question. Let's have a quick look. I can see Bal's name, but I can't hear you. Bal, can you speak? Okay, it's fine. Let's move on. We'll try and get the NPA technical team on the case to get Bal vocal. So a couple of questions that have come in, I guess, is first of all a question from Mohan about a pharmacy who wants to take part in the action, but actually his nearest competitor is not an NPA member. And what would the impact potentially be on his business if his patients think that he's offering a lesser service? And that's an excellent question. I don't know if, Paul, you're able to perhaps answer that for me?
Yeah, absolutely. So I know that we obviously have a lot of members, so we cover 6,000 of the pharmacy contracts out of roughly 12,000 across the 4 nations. But actually, a lot of people who are not NPA members have been in touch with us to ask us how can they support the Day of Action, what action can they take, and how can they get behind the Save Our Pharmacies campaign. So actually, it's not just NPA members who will be taking action. It's many people beyond the NPA, which is fantastic because this is obviously an issue that affects the whole sector. So I would encourage the person asking the question to work with us and take part in the Day of Action, and maybe talk to the pharmacy nearby and encourage them to take part in the Day of Action, because this is a sector-wide day that people are taking part in, and it's only by taking this sort of action that we can get our message across and heard by the politicians. So hopefully we'll see a good participation rate in the actions next week. But we have taken the decision to not call for actions that would diminish patient care. So hopefully patients will be clear that although symbolic acts are being taken, patient care and support is not being effective.
Thank you. And it is also worth probably saying at this stage, because we had another anonymous question regarding the participation of IPA AIM in this campaign, and I think it is worth to send, Paul, I'm sure you can reinforce that we have engaged with all pharmacy bodies, and we're willing to work with anyone who is willing to work with the NPA for the greater good of the sector. Is that right?
So we've worked with organisations across the sector. There's a whole host of organisations in the sector, and we've spoken to LPCs. They've been really supportive. We've spoken to various organisations, and of course, this is not really about the NPA. It's about saving our pharmacies, and that's why the name of the campaign is Save Our Pharmacies. It was a cross-sector campaign, and also the day is about saving our pharmacies. So any organisation that wants to support the day, we'd really encourage them to do that. They don't have to mention the NPA at all. We just ask that they support the action and use the Save Our Pharmacies slogan and the hashtag Save Our Pharmacies on social media.
Perfect. And is it? I think I've seen Ben put in the chat the link to our resources, but these are not behind the members' login. They are on the open web, so therefore anyone, members or non-members, can access them, and that will be in the chat, and no doubt we'll be putting that on social media again over the coming days. Thank you very much. Now, I believe, guys, we have Bal back on the call. So thank you for joining us and sorting out the technical issue. We'll come back to the questions in a minute. Bal, over to you, please. Bal is a board member, a new board member, has been with us for a few months, and he's really quality. I'm really excited to be working with him at the NPA. Over to you, Bal.
Thank you, Olivier. I appreciate that. So, and apologies for the slight technical difficulties up in the Midlands. So, just a brief introduction. So, I joined the MPA board just under 6 months ago. And for me, why did I join it? Well, so my journey is simply this. I kind of had been working for somebody else for a long period of time, kind of into my 40s, decided to buy a pharmacy in my wise wisdom. And that, 4 years later, we've got 7 pharmacies as co-owners. So everything was going really, really good. We've been actively involved. In my mind, there's been some stuff that I can be very, very proud of. And at the Birmingham event, I kind of shared some of that. So one of the things I can be proud about is the work that we did and all my team did during COVID. And I thought we were phenomenal. And then I think about to where we are right this minute in time, right this minute. And it's tough. I've been out there today working in Amber Farms up in Derbyshire, and we've done a lot of items, loads of queries, loads of questions. And, it's been full on the phone going, doing COVID vaccinations and all the rest of it. It's hard going. And what I've realized in all my time and all my years of working in pharmacy, I'm pedaling harder. And actually, not only am I pedaling harder for the same output as a pharmacist, but actually financially, I'm pedaling so much harder. And that balancing act of actually whether we can kind of afford to do the stuff that we want to do is really scary. And so for me, some time back, about 6 months ago, I kind of felt that actually, if there's something wrong and something's not right, I need to do something about it. And so I could see all the changes that were happening within the NPA. So I joined as part of a board member to represent all the members, all of you guys, and represent myself to share what's actually going on in coalface pharmacy. And bloody hell, sorry, excuse my language, blinking hell, it's scary. It is scary. It's not good. It's kind of frightening for me to know that actually, if I don't do something about it, then actually I feel that we might be just another post office scandal in the future. We might walk away and regret that we didn't do something about it. So for me, it feels right that I need to be doing something about it. So what am I doing then? So today, we've got about 5 doctor surgery within the area. I actually went and visited 3 of them and told them about the actual 20th. I told them what we're doing. I said, look, you don't need to worry. We're going to be shutting our lights. We're going to be closing our lights, but we're open for patients and we're there to look after patient needs. So at least they were kind of aware of that. And they absolutely love the fact that I spoke to them about what we're doing. And they said, look, can we help you with the petition? Can we help you? And I said, well, actually, I'm going to do some stuff on social media. I said, and they absolutely love the idea. So I'm going to have some pictures together with the doctor's surgeries posted on my social media. So I wanted to share a bit about how I'm going to go about it. So what am I going to do then? So we've got the postcards, that we can give out to people that I know that will actually add value and do something with it. I'm not going to randomly just hand them out. We've got the petition, which we're going to start, and we know it might last a bit longer, but we can get that ball rolling. I know it's not going to be just a one-day hit wonder. I think there's something about actually living and breathing it. So the third thing in my mind is not only having the material and all the items available to deliver the day successfully, but actually I need to engage my team. So I've kind of had a brief huddle with my team at lunchtime today, tell them all about what we're going to be doing, how we're going to be doing it, the type of questions that they might get, and really bringing it home as to kind of how much of a challenge this is in pharmacy. And we've got to stand up. We've got to stand up and be counted. And so with that, I then, as I mentioned, went over to the doctor's surgery, who were unbelievably engaged, which has given me that much more enthusiasm to think, actually, do you know what? This feels like the right thing to do. I think for me, it's about actually how do we work collectively? I know there's as many things that everybody's probably concerned about in any one of our pharmacies. What happens if somebody trips over? Well, you know what? These are all concerns we have all the time about anything that we do. And actually being cautious for me hasn't helped. For me, it's about doing something that's not illegal, whereby I don't get told off or struck off, but doing something together with all my colleagues that makes me feel proud of the fact, like we did at COVID, that we stood up and represented ourselves in the best way possible. That's me, guys. Thank you.
Wonderful. I think that's really inspiring. That to be brave to go and talk to your doctors, reassure them that you're not going to disengage from providing services, but actually doing a protest, and having their backup really shows that there is support out there. If you can get your GPs to be on your side, I think you'll find that you'll get your patients on your side without any difficulty. So thank you, Val. We're going to go on to the questions, and I think if everybody that's on the call there, not the participant there, the panel, please, can you go on camera, because I'll come to you if there is any question. I guess there has been a couple of questions from Simon Harris and Kim Gamble about the participation of the CCA or other chains, and trying to find out, what has the NPA done to engage with the CCA. So I'm sorry, Paul, I'm coming to you on that one again. Can you please share with us sort of the work that you have done with other organizations such as the CCA?
Certainly. So we talk to other organisations on a regular basis. I talk to Malcolm Harrison, the Chief Executive of the CCA. He actually happens to live about 1.5 miles from where I live in southwest Hertfordshire. So we not only meet up via Zoom and Teams, we actually meet up face to face. And we've got a great working relationship. We've talked to the CCA team about the Day of Action. We've shared our plans. We've done that with there are lots of organisations across the 4 nations that represent community pharmacy. We've had loads and loads of conversations, and I think ultimately, some organisations will be really full-throated in their support for the Day of Action. Some will be supportive, but will feel, for all sorts of reasons, they can't be totally, full-throated in the way that they go out there and support the campaign. All we can do is our best to galvanise people, to share the information with them, to invite them to take part in the Day of Action. This is the Day of Action about promoting the message that we need a fair funding deal for community pharmacy. And so we're hoping that we'll get as much support for the day as we can. We all know that the community pharmacy sector is incredibly diverse, has lots and lots of stakeholders, and will every single pharmacy take part in the Day of Action? The answer is no. I'm sure that's not going to be the case. There'll be some possibly large nationals who will feel that they can't do that. What we can do as an organisation is start the conversation going, get the ball rolling, get the campaign materials out there, hold the conversations, and encourage people to take part. Some really big groups are wanting to take part, and their chief, executives, spoken to me and other colleagues. So we just hope we get a good showing across the sector, and we want to make sure that we've done what we can to get the conversation going, to get politicians talking and to get the plight of community pharmacy onto the political agenda during the general election, because it's during a general election that politicians are actually listening to the people.
Thank you, Paul. And whilst we probably haven't had confirmation from any of those large companies whether they'll participate, we have certainly engaged with them. So that is good to know. Gareth, I'm going to come to you with regards to your question that we have had. Actually, we've had a couple of questions about first of all, our petition and whether only NPA members can sign or have patients sign that petition, but also some people are asking whether there could be a petition done online for the government in this election campaign, and whether that's something that the NPA would entertain. Can you please try and answer that for us, Gareth?
Yeah, thank you, Olivier. Questions about the petition. So we've made it available to whoever wants to use it. So it's not limited to NPA members. All the resources for this campaign are available for anyone in the sector that wants to use it, because it's obviously so critical that as many people as possible unify behind the campaign. So it's available to everybody. People have asked about the deadline. So currently there's no deadline, and we will give people plenty of notice before announcing any deadline for submitting the petition. There has been a question about using the government petition service. That's not available during the general election campaign. So that's why we'd like you to use the petitions available. If you did want to use the online version, it was initiated on the 38 Degrees website. So, you can sign there if you wanted to use the electronic version. But I think we've found historically a paper version in a pharmacy is quite a good way to engage with customers and patients and get good participation in the petition.
And I guess if we had an awful lot of signature on our petition and we were to land that on number 10 Downing Street in a few weeks, it would be really impactful for whoever goes into as the new Prime Minister, as a message from the National Pharmacy Association, or from pharmacy in general, really. So that's really good. Thank you very much. We've had a question on the campaign pack, which was sent to NPA members. The question is, has the campaign pack been sent to everybody, and also, or just NPA members? And then I would like to link another question about the NPA sending some lines for pharmacy staff to help to get the message out. And I'm not sure whether that's the message out within the pharmacy or on social media. I don't know if Gareth or perhaps Ben, if you are around, you are able to help with that part. Whether material are being sent out to pharmacies. Perhaps Gareth, if you want to try and answer that, and then if Ben wants to add something to it.
Yes, so well, if I start with the lines for pharmacy staff, I think that's a really good idea. That's something fairly simple that we can produce. So I think the suggestion is, if pharmacy staff are given a few key lines, they can use that in engagement with patients in the pharmacy. So yeah, we will do that, and we'll send that out to people. Yeah, I don't know if Ben wants to add anything on the pack situation. Yeah, I'll hand over to Ben for that.
That's fine. Evening, everybody. Yes, absolutely. We've sent out packs to all NPA members and to a huge number of pharmacies who are not NPA members directly. We hope they've arrived. We think most of them have. If you've not got one, you can get in touch with us. But the quickest way to find them is if you look at the web address, which is in the chat, npa.co.uk/campaign/saveourpharmacies, which you'll find in the chat. You'll find all these resources available to download, so you can download and print them out right now. So these are all, so these all should be available. If you've not had a pack and you want one, you're very welcome to get in touch with us, and we'll do our best to get you the materials, because we have a few spares in our office in St Albans.
Thank you, Ben. For those who don't know Ben, he's our sort of head of communication, and therefore very much involved with this campaign. Thank you, Ben. There's been a question from Jitendra, sorry, about the activity fee in community pharmacy that needs to increase because the minimum wage is increased and costs are increasing in the pharmacy. This is all costing us money, and I guess we are not Community Pharmacy England. We don't negotiate with government, but I don't know whether, Paul, you're able to give us a little bit of a steer as to the communication you might have with Community Pharmacy England as to what needs to be addressed. Bear in mind, Community Pharmacy England is probably a little bit in limbo during this election campaign as well, and things have probably paused. If you can say a few words on that, I would appreciate it.
Absolutely. As it happens, I spoke to a very senior government official today about this very same issue, about the fact that firstly, the step up in England to 20 consultations in August and then 30 in October was too steep and should be moderated, that there should be some activity fee, because of course, when pharmacies are seeing patients who are walk-ins, they don't hit the gateway, then pharmacies aren't being paid for those consultations. So I was putting it to the Department of Health senior official that should be the case, and that the 1,000 payment for each month should be guaranteed. Obviously, the senior official couldn't really comment on what might happen, but they certainly took down lots of notes and got the message. And I was saying that if something along those lines wasn't forthcoming, there was a risk that some pharmacies would feel they couldn't hit the 20 consultations a month from August or the 30 from October. There's a risk that some of them will just simply decide to walk away and vote with their feet. That's something that we are raising with officials in NHS England as well, that the Pharmacy First model in England needs to be reassessed, and it needs to be implemented in a fairer fashion, a way that's more supportive to pharmacies to take part in Pharmacy First and help deliver. So we do raise that with senior officials. We raise it with politicians when we speak to them. And obviously, we discuss those sorts of things with CPE as well, in terms of what we would suggest CPE say, because of course they are the negotiating body.
Thank you, Paul. We are also having some questions regarding the involvement in Northern Ireland and in Wales in terms of what conversation your members are having with yourselves. I just wonder whether Janice and Rodri, whilst we have you on the line, whether you can share with us whether your pharmacies are also having or making their patients sign a petition, whether they are encouraged to engage with non-NPA members in Wales, whether you're having conversation with the CCA. I'm well conscious that things might be slightly different. So, Rodri, you've just come off mute. If you could just let us know what specific actions are being taken by members in Wales.
So the feedback we've had is that members in Wales will be taking a lower key approach. There is a little bit of awareness that the annual negotiations with Welsh Government are very close to being completed. But however, they are taking a more direct approach to their elected officials or those standing for election and contacting them directly to make them aware of the challenging environment. The action they're taking with patients is to, as I alluded to, is explaining to them the challenging funding situation. So when they're making decisions regarding removing deliveries or removing trays or monitored dosage systems, they're using that as an opportunity to have the conversation with patients around the funding situation. So it's a more subtle but direct approach that they're taking. There are some pharmacies who are engaging with the day of action, but on a broader scale, it's not quite as high profile.
Thank you. Janice.
Yes, our packs have just recently arrived. They are out there with members and non-members, and I've had lots of comments in from members saying, yes, we've got them. What do we do with them? What's the best actions for ourselves in Scotland? Many members have been eagerly waiting them so they can use them as a tool to engage with the politicians local to them. And they see that as making a real impact to their communities to understand actually what happens within a pharmacy and how challenging it is. So yes, we'll probably have a whole range like elsewhere, and there'll be some groups that will engage closely now, some pharmacies that are really active on the day, and then there'll be others that will be saying, right, okay, let's see where we can go with this. It's a long campaign. It's not just that day. And I think these, what we have provided everybody there, really enables the right conversations to be had, or right opportunities to be taken at the right time. And whether that be on the day or thereafter, and absolutely targeting whoever it is that those conversations have to be with, they've been really welcomed.
Thank you very much. Val, you want to say something? I've got a couple of questions about funding and Parliament, which I'm going to Parliament candidate, which I'll come on to in a minute, but you have your hand up. Do you want to say something?
Yeah, Olivia, I just wanted to kind of just add on that last sentiment by Janice, and I think she mentioned it brilliantly well, which is that this is a long campaign. And just remember, if we did something for 2 hours, actually, whilst you may feel that 2 hours isn't enough, don't forget, actually, whatever we put on social media, whether it's a picture with a politician, or whether it's the MP or with the doctor's surgery, lasts a lot longer. And that has profound impact. You'll see stuff on social media that will last for days, if not much longer than that. So actually, even doing something for 2 hours and putting it on social media has a massive impact. So I think I just wanted to reiterate how we can actually magnify what we're doing.
Thank you very much.
Thank you, Val. And if I can interject, Olivier, if that's okay, I'll just add one footnote in terms of Northern Ireland. I know that pharmacies there are really keen to get involved on the day, and CPNI has been in touch with us a lot, asking, how can they support the day. So I think a lot of pharmacies there will be supporting the day of action.
Thank you. That's wonderful. Thank you very much. A couple of questions. One, I suppose, again, for our communication team, Gareth and Ben, regarding possible messages to give to parliamentary candidates who might be knocking on our doorsteps or been invited to come to a pharmacy, and then suddenly, what sort of good questions would be there? And can the NPA produce sort of an attachment as part of the campaign material, which could be shared with MPs?
Yes, absolutely. There's various materials online, both on our website and on the cross-sector votepharmacy.org website, which includes briefings for parliamentarians, which are good for parliamentary candidates to explain the situation. But we can certainly update our website with some key questions outlining the issues. We find the best thing to talk to candidates about is just to share your experience, what it feels like for you, how the funding situation is affecting you. And the best advice when talking to them, the thing that has the most effect, is to always come back to what it means for your community, your patients, and the people they serve, because what politicians care about is voters, and how this crisis is affecting their communities and their voters is what they will really care about.
And thank you very much, Ben. And talking of funding, because obviously Jitendra's question about activity fee in relation to dispensing prescriptions perhaps hasn't been fully answered. I wondered whether, Gareth, you could tell us a little bit more, if you can, about the funding and the conversation we're having about dispensing fees and fundings.
Yeah, so we have been speaking to Treasury recently a number of times. It's taken us many years to get through the doors of Treasury, and ultimately they are the people who decide how much money comes to community pharmacy. Department of Health, NHS England essentially are handed the budget. It's ultimately Treasury decides how much money gets passed across to health. So, those are important conversations we've had. We've talked about the £1.3 billion shortfall for community pharmacy. We've talked about all the increases in costs and the 40% real terms cuts in community pharmacy. They do understand what's happening. They do tell us, how difficult the position is that they're that we are in. I think that what I think has been really positive in terms of Treasury is Pharmacy First, and the fact that Treasury invested money, and within a day of it starting, of the service starting, community pharmacy was seen to deliver, and that does bode well for the future, because when Treasury sees they invest money and they get a return, that really makes them think about further investments in community pharmacy. That's not often what happens when they invest in the NHS. They don't see much of a return. GP access doesn't necessarily improve. Hospital waiting lists don't reduce. So there is some reason to be optimistic about some of those high-level economic decisions in the future. But I think it's important to note that we are having those conversations now.
Perfect. Look, guys, we promised to keep this under an hour, and we are probably 4 minutes away. So we have answered most of the questions. If there are any unanswered questions, we will pick them up offline. From what I can see, I think we've tried to address pretty much everything that was asked, albeit a lot of the questions that came, and we've had dozens of questions, were all very similar, which is why we wrapped them together under shorter versions. But I just wanted to finish by asking you and yourself, asking yourselves, why join the day next week on Thursday the 20th? Well, I'll tell you something. I go to CPE meeting, I go to NBA meeting, and I hear stories. And the story I hear is some people remortgaging their homes in order to keep their doors open. I even heard of a pharmacist who remortgaged their house but didn't tell their family, and that was also to keep the doors open. This could be us. This could, we're all in this together, and we wouldn't want to be in this situation. So why take part, and why the 20th of June? Well, we know that we only funded to about 60% of where we need to be, and the 20th of June falls about 60% in the month of June. So any work that you do beyond the 20th of June is for free, is some work that the NHS get out of you for free, or out of us for free. As a result, we would really strongly recommend you participate. So in order to sum up, I'd like to think that in the next few weeks, we can all engage with our MPs, and the NPA has produced resources in order to do that, and we will put more. We want you to go on social media, if you are indeed on social media, and we want to use the Save Our Campaign, Save Our Pharmacy campaign hashtags. And I would follow Paul, because Paul will give us a regular update of what the NPA is up to in terms of engaging with the media, with politicians. You want to get people to rally around you. We heard from Bal, who's engaged with his local GP. I, a few years ago, organized a rally outside my pharmacy, and I'm planning a similar rally on the 20th, starting as early as 9 o'clock. We're going to put the black sheet on the windows. We're going to put people outside. We're going to have a banner that say, we're working at candlelight to make a point. And we are also going to invite the media. If we can make a story out of it, and invite some MPs along the way, then it's even better. MPs are not in Parliament. They are all available campaigning. You should be able to get them any day of the week. Get them in your pharmacy around the 20th. Go to the NPA website, get the resources. And finally, I often hear, why do we not strike like doctors, like nurses? Well, we don't believe in strike. We stayed open during the pandemic. We want to stay open for our patients. Our patients need us, but we need to make a point. And the 20th of June is the day of action where we can do that. So join us in our campaign. I think, Paul, there will be another webinar next week, the day before the campaign. I look forward to being on there. There will be communication on that. It's 8:29. I've managed to wrap it up within the hour. Well done, guys. Enjoy your evening. Happy campaigning, and anything we can do, contact the NPA and we'll support you. Have a pleasant evening all. Thank you very much.
Thanks very much, Olivier. Bye, everyone.